So this was an intervention that we ran with the women's Lightning elite development team at the university over their winter training block this year. So just a bit of an overview of what we did, some of the practical sort of logistical limitations, and then some of our outcomes and some reflections. Just thought I'd start with this and kind of where we fit in this translation of research to practice. And this was a model from Dave Bishop 10-15 years ago, and we're very much in this last stage of, we've heard about the overview of the kind of underpinning science, some of the experimental work, and we're really trying to take that step to implement this into practice and try and identify some of those barriers and then sort of feed those back into the research. In terms of a little bit of the context of the training approach for the team, Stephen Seiler's hierarchy of endurance training needs summarises it quite nicely. We've got a big focus on training volume and developing that chronic training load, then layering on our high intensity work, changing that throughout the year, which we'll touch on, and then how we distribute that training, which would be a polarised or a pyramidal approach. Consistency is super important to us, so trying to prioritise that rather than having a couple of great weeks and then falling off a cliff, that consistency over time. And then, yeah, as I said, this polarised or pyramidal, we can get into those arguments another day, but large percentages of zone 1, easy and low intensity work. In terms of our sort of progression on the interval side of things, again, it would all be underpinned with low intensity volume, but we'd start with very short intervals, 10 to 20 seconds, essentially maximal effort with really long recoveries. Pull those out to more anaerobic capacity type work, 30 seconds to 2 minutes. We then have a retesting point there, and if we feel that VO2 max is an area that we could further develop, we try and spend lots of time at or around VO2 max. And then that sort of penultimate phase is trying to pull those sub-max thresholds up to as high a percentage of VO2 max as possible. And then we get super race specific in March, April time, and then just maintaining performance and recovering as much as we can throughout the season. In terms of a typical week throughout the winter, this is roughly what it would look like. We typically have 2 high intensity days, and then the other days are low intensity in nature, and we double up with S&C on those high intensity days. And yeah, we'd have those 20, 30-second efforts. And given this was what the training was going to be anyway, this is where we thought, is there a potential to layer on an additional stimulus, and whether BFR could be that.
So, yeah, obviously Richard and Don have kind of overlaid and talked a little bit about this, that we're, as a group, we've got a good training history with these guys. They're consistently performing quite a high volume of training, but obviously if that adaptive stimulus is starting to decrease over time, that we know it does, is there anything that we can get that extra spike in adaptational stimulus each session? And equally, will that eventually accumulate to create a greater adaptation? Was what we were looking at during this winter blocks. We do have a 3-month period to do, play around with things before we get more to the sharp end of getting into racing. So BFR was something that we thought could add that extra percentage, possibly accumulate to that greater adaptation. And especially, as Paddy said, we've got 2 sessions that this sprint interval training or this BFR training could fit quite nicely into. So that was one thing that we were thinking about when we were going to implement it. But we did have some caveats as well, that, as we talked about, consistency is really important for us. So we didn't want to add an extra stimulus that came at the cost of reducing their overall chronic training load, or equally it came at the risk of, when we've got those double days with resistance training as well, that didn't also get decreased as well. So we think those are 2, for our developmental cyclists, important elements that we really want to keep within the program. So when we were thinking about this, we wanted to move and understand what might be the most appropriate protocols to use out of literature as well. So we created a bit of a decision tree to where we place which one of our athletes might do which different type of stimulus in terms of if we are going down the BFR route. So on the side that we wouldn't look at BFR is someone if they haven't done chronic training load or haven't got a history of it, a good level, or equally they haven't got a gym-based history either. So that's maybe we need to prioritise something else. We need to prioritise getting those implemented into a program before looking to the BFR. But if we do have someone on the other side that has good chronic training volume, has good tolerance of doing resistance training as well as endurance training, then we'll probably go down that sprint interval on the kind of this side, sprint interval training with the BFR and recovery. So kind of what Donald and Richard have presented so far. On the other side, if we have some concerns either that we have got a good chronic training load, but maybe haven't implemented resistance training in within that, which we did have quite a number of our cyclists in that sort of category this year because of not being able to, when they enter into a university environment, not many of them they will be cycling and competing on the cycling side, but they won't have S&C fully intertwined like we do at Loughborough. So there is a few that kind of fall into that bracket, or equally if you had a bit of worry about trying to get them up to the higher levels of volume that we do try with our performance team, we'd probably go into this continuous low moderate intensity training, but BFR continuous within that. So Paddy will talk about what those sort of sessions actually look like a little bit more, but for me to get through it, I'll move on. The other type of sessions, so the gym-based, low resistance training with BFR, that would be, we didn't actually have anyone fall into this category, but that might be where someone is quite happy in that gym environment, so it might be a transitional athlete. So they're happy in the gym, but we're trying to improve the amount of time that they spend on the bike. So we might keep it in the realm that they're comfortable with performing more training within. But how that kind of figured out was we had our lightning squad of 6 riders. We kind of had 3 that fitted more into that sprint interval side and 3 that went into that continuous low moderate intensity training with BFR during intervals. So that's how it kind of filtered out, and was just a little bit of a rationale of how and where we place different athletes on that journey.
So in terms of actually designing the sessions from a coaching standpoint, had sort of 2 variables that we were essentially trying to progress across the 5 or 6 weeks that we had the athletes performing the sessions. One was around reperfusion, so actually how many times does the cuff go on and then get released and get that shear stress coming through the muscle. And then the other one was around the homeostatic perturbation, so the state of the muscle at the end of, say, a sprint interval or a continuous bit of exercise. So that's what we were trying to progress. In terms of the sprint interval protocol, we had a familiarization session just to get used to some of the strange sensations of BFR. Then we started with 20-second efforts, progressed that from 6 to 8, and then extended the duration of the effort up to 30 seconds, dropped the reps down and went for 5 and then 6. In terms of the post-exercise BFR, we tried to get the cuff on as soon as possible. Talk about some of the logistics around that in a minute. That was then inflated for 2 minutes at 60 to 80% of the pressure that would occlude the whole limb. 2 minutes of passive, an easy spin, and then cracking on with the next interval. In terms of the lower moderate intensity, we didn't feel, just from testing it out ourselves and with some of the athletes, it wasn't worth dedicating a whole session to it in itself. So we had athletes perform their normal interval session without BFR. So that could be some sprint intervals or some 1 or 2 minute type efforts, have 10, 15 minutes easy, and then we'd have the continuous BFR afterwards. So we're working around LT1 and again, progressing the number of reps and then extending the duration. The cuff pressure was quite a lot lower for this. It just wouldn't be tolerated at, say, 60 to 80%.
So during the sessions, I'll just chat to you about some of the logistics of doing this practically. So the picture on the left is just a sort of the continuous efforts they were doing. So they'd wear the cuff while riding, and some of the problems we'd have is, for example, while they're in a 2-minute effort, the cuff would start sliding down and you got to stop, put it back up. Some technical issues, like we had the pumps were Bluetooth connected. So if you've got 6 phones and 6 pumps all trying to connect at the same time, sometimes they either wouldn't connect or connect to the wrong person's pump. During the sprint intervals, so I saw in Dr. Ferguson's video, you guys had a splitter. So with our pumps, we only had 1 tube. So when the girls got off the bike, sat down and connected their cuffs, got to inflate one, wait, inflate the other one. So that means one leg is occluded a bit longer than the other. So it's just little things you had to work around while running this intervention. And then we had some sessions where the girls couldn't complete the planned session just because of accumulating fatigue, getting a bit uncomfortable. And some of the sprint interval girls would start to feel a bit sick after maybe 3 or 4 sprints at the beginning. And yeah, so just some practical stuff that didn't quite work out the way we planned.
Yeah, it wasn't. So that was sort of the reality of trying to apply it as practitioners. And we also, as Paddy's outlined already, that this was the plan of what the sessions we were trying to achieve. We'll now kind of describe a little bit of what the reality was. So as usual, messy in real life. So on the right-hand side is basically the amount of work done in the continuous group. So the aim was generally to try and progress, obviously, the amount of work done around that threshold, trying to increase those muscular perturbations. So we didn't necessarily see an overload or a progression in that, as you can see across the graphs. But generally, these sessions were tolerated a lot better than what the sprint interval ones were. So quite successfully, they got 4 sessions in. Didn't do the last session. Neither groups did the last session. There's a mixture of different things of why that last session didn't actually happen. One was, so session 4 and 5 were Christmas break, so athletes took cuffs back, took them back home, they got one done, and motivation may have dropped a little bit for that second one. Equally, I think there was a bit of a coaching decision with Paddy that when we'll get into the 6th week of the intervention, that was where there was starting to be maybe a bit of a breaking point, maybe more psychologically than physically, but just we ended up on both 5th weeks, we didn't actually get many through that. On the sprint interval side of things, we did see on the right-hand side, you can see a nice progression in the amount of work done during the sessions. So there was a little bit more of an overload there. The issue wasn't maybe with that side of things, but the actual number of reperfusions we maybe achieved. So this is the ticks and crosses is how many BFR sprints one of our cyclists achieved. So first session, there was 6 that were planned. We got 3 sprints in. By the 4th one, they felt sick. They didn't want to perform the sprints. So we still performed the sprints, but without BFR included there. So we had to rephrase going from 6 to 3, and almost we were just trying to get an extra sprint each time with the BFR associated. So there was a bit of a detraction away from the volume of reperfusions that we'd hoped to get in, just being the reality that it was rough on the guys and they did struggle to get the amount that we wanted to do. So there's a discussion there of when we get into our results that we found, did we actually get enough of the stimulus to get those adaptations that we wanted to, well, we'd hoped to see.
So this is just a little bit of the monitoring we do with our cyclists. So it's just a measure of the muscle soreness and fatigue. And what we were looking for, so if you see this grey line here, this is the average sort of fatigue muscle soreness before the intervention, just throughout the whole year. And we were prioritizing making sure the girls can still do their normal training plan outside of the intervention. So although there's a bit of fluctuation, generally this cyclist didn't really go outside of sort of one standard deviation of her normal sort of fatigue. So that's a good sign that the BFR wasn't really interrupting her usual training. But then when we have this cyclist here, for example, she started declining a bit after those sessions. So she only did 4, but if you compare the start and finish of her intervention, she ended up very much in the red. So we sort of thought if we pushed any more, doing any more sessions, maybe it wouldn't be so applicable in terms of making sure she's still getting all of her volume in.
So this is then just some of the results. So we performed pre and post testing on this with VO2 max, lactate thresholds 1 and 2, as well as critical power testing using the 3 and 12 minute model. We saw in absolute VO2 max a marginal increase. No one definitely went down, but there was a slight improvement in VO2 max that we saw. We also saw pretty good results in terms of our critical power across both groups. Moved on quite nicely within that. Interestingly, the sprint interval group, their actual 12-minute was the one that really did boost up. But obviously, everyone knows having only 2 points may have an interaction on that. The one thing that was slightly different, so that power profiling and maximal worked quite well. We saw improvements. The underlying lactate threshold, so the sub-maximal data that we got from it, wasn't so successful or wasn't so sort of beneficial, we saw. So we had one that was a massive responder, So those declines are without that massive change included there, because generally the trend was probably towards less efficient performance across their submax profile, which was something that me and Paddy are still trying to unpick. But that was our results from those the pre and post testing.
Yeah, and then just thought to finish up with some data that we've got from an athlete who's been in the program a slightly longer period of time, so we can look at it sort of longitudinally. You can see test 1 is from January 2021, and we've got an equivalent time point, which was end of January, start of February in 2022, so recently. And tried to have a little look at the 3 months of training prior to both of those testing points. So you can see a year ago, the distribution there, so around 80% zone 1, 15 and then 5. In terms of the most recent 3 months, we layered on BFR. It was slightly more polarized, or a greater percentage in zone 1, but a fairly matched training load. There are issues with TSS, but on the right hand side, you can see fairly matched between those 2 periods of time. In terms of performance outcomes, we did see a shift in absolute VO2 max, but I think you can see from the November testing time point that probably happened over racing during the season. So it would be nice to attribute that to BFR, but that probably wasn't the reason there. Just pulling out some of the training data, a key session that was done in both years was 5 times 5 minutes, which will elicit a lot of time at VO2 max. I mean, last year was around 280 average for all the reps, but this year was up to 300, so a 7% improvement there. And then just in terms of 3 and 12 minute power, you can see compared to January 2021 a year ago, we're further ahead. So we've made improvements there, and pretty similar to where we were at in peak race condition. And with the 12, we're actually ahead of where we were at going into racing last season. So again, it's one athlete, hard to make conclusions, but certainly responded well to this intervention. And similarly with the underpinning sort of metabolic and lactate threshold data, everything's shifted from peak condition in racing last year.
So just a couple of finishing points on what went well. So we saw improvements in their critical power and the VO2 max. There was no detrimental effect if you look at that monitoring again. So the girls managed to stay pretty close to their sort of average soreness and still managed to crack on with all their training. So it's tolerated well. So like I said, they still got on with all their training, still got their gym sessions in afterwards. And there was just generally a good motivational group setting for them to all come and train together. So I'll pass on to...
And yes, the bits that we think didn't go quite so well, or we want to try and improve on for next year, was again the technique of, so we used the Suji cuffs. It was hard to get a rapid inflation on those and maintain a good inflation on there to obviously create that blood flow restriction. So if we can get the splitter, if we can get a better ability to be able to deliver that stimulus, would be beneficial and maybe help us get a better stimulus out of the protocol and the intervention used. Obviously, our underpinning submax data isn't as supportive as that performance profiling in terms of the top end of their physiology. Obviously, there's some bits that Richard's referred to today that we might show where we've seen adaptations and where we may not have seen them. And finally, we probably didn't achieve the planned sessions. So we didn't get as many reperfusions as we want. We probably didn't achieve the kind of muscular perturbations that we were aiming for. So that could have had an influence on reducing that the stimulus that we were trying to achieve. So we've obviously got some relatively good data, but is there more that we could have optimized to keep pushing it forwards?